Respiratory infections are incredibly common. They range from mild colds to severe illnesses like pneumonia. They affect millions globally every year. These infections do not discriminate and can impact anyone. These infections target your respiratory system, which includes your airways, lungs, and related muscles and blood vessels. When infected, it can make breathing difficult and cause symptoms like coughing, sneezing, and a sore throat. Viruses usually cause these infections. The common cold, influenza, and COVID-19 are examples. These tiny invaders spread easily through the air or by touching contaminated surfaces. They travel through the air when someone coughs or sneezes. Cover your mouth and nose with a tissue or your elbow. Simple actions like wearing masks, washing hands, and maintaining social distance can reduce the spread. There are many different types of respiratory infections. These infections can range from mild to severe, affecting people of all ages. Understanding the common types and their telltale signs can help in early diagnosis and treatment. Each type has its own set of symptoms. Recognizing these symptoms can be the first step towards getting the right treatment. For instance, some infections might cause a mild cough, while others could lead to severe breathing difficulties. The common cold is a frequent offender. It's usually characterized by a runny nose, sneezing, and a sore throat. While it's generally mild, it can still cause significant discomfort and disrupt daily activities. It brings with it a runny nose, congestion, and sore throat. These symptoms are often accompanied by sneezing and a general feeling of being unwell. Over-the-counter medications can help alleviate these symptoms, but rest and hydration are key. The flu or influenza is more serious. Unlike the common cold, the flu can lead to severe health complications, especially in young children, the elderly, and those with weakened immune systems. It can cause high fever, body aches, and fatigue. These symptoms can be debilitating, making it difficult to carry out daily tasks. In some cases, the flu can lead to pneumonia or other serious respiratory conditions. Bronchitis inflames the bronchial tubes, leading to a persistent cough. This condition can be acute or chronic, with chronic bronchitis often being a result of long-term smoking or exposure to irritants. Pneumonia, a more serious infection, affects the lungs and may cause difficulty breathing. This condition can be life-threatening, especially for those with pre-existing health issues. Symptoms include chest pain, fever, and a severe cough. Recognizing these symptoms is crucial for early detection and treatment. Early intervention can prevent complications and improve outcomes. Always consult a healthcare professional if you experience any of these symptoms. Treating respiratory infections depends on the cause. Antibiotics are effective against bacterial infections like some cases of pneumonia. However, they are useless against viral infections like the common cold or flu. Antiviral medications can shorten the duration of the flu. Over-the-counter medications provide relief from symptoms like fever, cough, and congestion. Rest is crucial for recovery. It allows your body to fight off the infection. Staying hydrated is essential. Fluids help thin mucus and soothe your throat. Alongside medical treatments, home remedies offer comfort and support. A humidifier adds moisture to the air, relieving congestion. Gargling with salt water soothes a sore throat. Drinking warm liquids like tea with honey can ease a cough. Resting in an upright position can improve breathing. These simple yet effective measures help manage symptoms and promote healing. Section 5. When to seek help. Recognizing warning signs. While many respiratory infections resolve independently, some require medical attention. Seek medical care if you experience difficulty breathing, chest pain, or a high fever that persists. A persistent cough that lasts for weeks or produces discolored mucus also warrants a doctor's visit. For infants and young children, consult a doctor if they have difficulty breathing, are not feeding properly, or exhibit lethargy. Early intervention can prevent complications and ensure the best possible outcome. Section 6. Protecting yourself and others. Prevention strategies for respiratory infections. Preventing respiratory infections is always better than treating them. Frequent hand washing is crucial. Use soap and water or an alcohol-based hand sanitizer. Cover your mouth and nose when you cough or sneeze. Use a tissue or your elbow to prevent the spread of germs. Avoid close contact with sick individuals. If you are sick, stay home to avoid infecting others. Vaccination can prevent serious respiratory infections like the flu. Section 7. Navigating respiratory infections in clinical settings. When you visit a doctor for a respiratory infection, they will assess your symptoms and medical history. This initial consultation is crucial as it helps the healthcare provider understand the context of your illness. They will ask about the onset of your symptoms, their duration, and any other relevant medical conditions you might have. This comprehensive history-taking allows the doctor to form a preliminary diagnosis and decide on the next steps. They may perform a physical exam, listening to your lungs and checking for signs of infection. This physical examination often includes using a stethoscope to listen for abnormal lung sounds, such as wheezing or crackles, which can indicate the presence of an infection or other respiratory issues. The doctor might also check your throat, nose, and ears to look for additional signs of infection. In some cases, they may order additional tests, such as a chest X-ray or blood tests, to confirm the diagnosis and rule out other conditions. A chest X-ray can reveal pneumonia, bronchitis, or other lung conditions, while blood tests can help identify the presence of a bacterial or viral infection. These diagnostic tools are essential for providing a clear picture of your health status and ensuring that you receive the most appropriate treatment. Following your doctor's instructions regarding medication and home care is essential. This might include taking prescribed antibiotics or antiviral medications, using inhalers, or following specific home care routines like rest, hydration, and steam inhalation. Adhering to these recommendations can significantly speed up your recovery and prevent complications. Don't hesitate to ask questions and express any concerns you may have. Open communication with your healthcare provider is vital for effective treatment. If you experience any side effects from medications, or if your symptoms worsen, inform your doctor immediately. They can adjust your treatment plan accordingly to ensure the best possible outcome for your health. Section 8. The importance of vaccinations. Vaccinations play a vital role in preventing serious respiratory infections. The flu vaccine, for instance, reduces the risk of contracting and spreading the influenza virus. Similarly, the pneumococcal vaccine protects against pneumococcal pneumonia, a potentially life-threatening infection. By getting vaccinated, we not only protect ourselves, but also contribute to herd immunity, safeguarding vulnerable populations who cannot receive vaccinations. Section 9. Long-term effects and management. While most respiratory infections resolve without lasting complications, some can have long-term effects. For instance, repeated lung infections can damage lung tissue and lead to chronic respiratory conditions. Managing these conditions may involve lifestyle modifications, pulmonary rehabilitation, and ongoing medical care. If you experience persistent respiratory symptoms after an infection, consult your doctor to discuss potential long-term effects and management strategies. Section 10. Breathe easy. Taking control of your respiratory health. Respiratory infections are a common health concern, but we can take proactive steps to manage and prevent them. By understanding the causes, symptoms, and treatment options, we empower ourselves to make informed decisions. Practicing good hygiene, getting vaccinated, and seeking timely medical care are essential. Remember, knowledge is power when it comes to protecting respiratory health. By taking control of our respiratory health, we can breathe easy and live healthier lives.